Hello and welcome. Today we have a special guest, Mark Mead. Mark earned his Master's of Science degree in nutrition from UNC Gillings School of Global Public Health. He has an extensive background as a holistic nutritionist, a medical writer, and integrative cancer coach. His professional experience includes work as a personal nutritional coach and consultant for 5 integrative medicine clinics, and 15 years of experience as a research associate for the Block Center for Integrative Cancer Treatment in Illinois. He currently offers consultations and coaching sessions to cancer patients and survivors, and these sessions can be coordinated over the phone or by Zoom or Skype. Regardless of your diagnosis or health situation, Mark is an excellent resource for guiding you toward optimal health and cleaning and healing. You can reach Mark through his website, selfhealingoptions.com. Welcome again. So, Mark, when we met a few weeks back at a medical conference, you presented an interesting talk, and you were talking about DCIS, ductal carcinoma in situ. Can you tell us a little bit more about this?
Yeah, ductal carcinoma in situ is also known as stage 0 breast cancer. It is a very early stage. It's considered to be a pre-invasive form of cancer. And what interested me in this initially was the finding out that that this entity really wasn't known until the 1980s, and then also finding out that often it doesn't ever progress to become invasive breast cancer. And the more I looked into it, the more I realized that not just ductal carcinoma in situ, but even other early stage breast cancer situations will either have a very slow development that never becomes aggressive, or has a kind of a sporadic growth rate. So there's quite a variety of ways that breast cancer can evolve. And DCIS is a fascinating case because, over 50,000 cases per year diagnosed in the United States, and it's being overtreated. Very often what happens is, because the word carcinoma is in there, we get frightened, and so we go for the first treatment option, which in cancer is almost always surgery. So many women are getting mastectomies, and a lot of women are also getting what's called wide local excision, which is like a lumpectomy. And so that conserves the breast, but then they go through radiation treatment, and that radiation treatment very often predisposes them to heart disease later on, as well as certain cancers like lung cancer and esophageal cancer. But heart disease is the biggest risk. So what we're starting to realize is that many of these cases do not need to be treated so aggressively, and that's why I became interested in it.
My understanding that 25% of all mammographic positive findings have to do with actually DCIS, which is classified as stage 0 cancer. Mm-hmm. And I also understand that probably something like 80% of them are never become invasive. And therefore, if someone is given the diagnosis of, as you said, something carcinoma, then someone is basically being diagnosed with cancer, but at the same time, it's totally encapsulated. In the majority of cases, it's not really life-threatening. As a matter of fact, years ago, I came across the statistic that 80% of 80-year-old women who passed away from another cause, and during autopsy, they found that 80% of them will have DCIS.
Hmm.
However, the cause of their mortality happens to be something else. So, like you said, there are 50,000 women that are diagnosed in the United States alone with DCIS, and the treatment seems to be a little bit too aggressive. I understand that nobody wants to take a chance because nobody really knows whether it's going to progress or not. But at the same time, there's something that just doesn't kind of connect for me personally.
Yeah, I think it's there's so much cultural fear around cancer that we're used to responding to it in a very fear-based manner, and that is typically cutting it out. Unfortunately, when you cut out cancer, you often set yourself up for other treatment requirements and complications and risks and so forth. And with this DCIS, we have an opportunity to think a little bit differently about how we want to respond. Just kind of like how we respond to criminal behavior in society. We can slap a serious sentence on a criminal and be very aggressive, or we can try to rehabilitate them and get them to behave in a different way. And I think that's a similar situation with cancer, is that we have an opportunity to think more about the biological conditions that are supporting cancer and that are feeding it its progression. What are the things that feed its progression? We know that inflammation is a critical piece of that and drives a lot of the aggressive behavior of this disease. If you can quiet the inflammation down, you will see much less of that progression happening, and that is something that is very well established in the science of cancer. It's just that we're not really applying that clinically. We're not taking that information and making it more of a policy. Okay, let's take DCIS that is low grade, that is low risk, estrogen positive, which should also be low risk, HER2 negative, grade 1 or grade 2, and those would all be considered low risk. The chances of those progressing is extremely low, and I think we can even change that probability by encouraging women to use dietary and lifestyle strategies that bring their inflammation down. And there are other things that can be done. Intravenous vitamin C is being used very effectively in some areas to eliminate small tumors. So there's different ways of dealing with it that are not aggressive, that are going to allow the woman to have a much better quality of life, and potentially avoid some very dangerous conditions down the road.
So you mentioned kind of rehabilitation or prevention.
Yeah.
Let's talk about rehabilitation. How would you, first of all, what methods do you personally use with your clients to prevent? And probably it's more or less the same thing in terms of rehabilitation with someone who has.
Well, we know that an anti-inflammatory diet, which is basically a plant-based diet, we know that this type of diet reduces the mortality for women with breast cancer.
Mm-hmm.
Also lowers recurrence rates. Part of that approach is not only using a lot of antioxidant-rich, anti-inflammatory foods, like olives, for example, are very anti-inflammatory, and all kinds of green leafy vegetables, but also changing the types of fats in the body. And so if you have more omega-3s and less omega-6, you're changing the ratio of anti-inflammatory to pro-inflammatory fats. And that can have a profound effect on many parameters that are associated with the progression of breast cancer. These are, fairly basic self-care strategies that can be incorporated on a daily basis. And I think that's where the real change can happen. The problem with cancer these days is a woman goes in and gets a diagnosis, and then the doctor says, well, we'll just have to hope for the best, and let's just, hope that this doesn't progress into cancer. But really, the best way that medicine could be practiced at that point is to teach women preventive strategies that increase their anti-inflammatory power in their body. In terms of if it was a more higher risk situation with DCIS, which would be a grade 3, or an estrogen negative, estrogen receptor negative DCIS, then we might use something like intravenous vitamin C, which is also considered to be a minimally toxic form of chemotherapy. It's a whole body treatment that works especially well with very small clusters of cancer cells, and has shown a lot of efficacy even with more aggressive cancers, but it has to be used in a more intensive way for those. For something like this, it could be 2 or 3 infusions for 2 or 3 weeks, 2 consecutive weeks of, say, 3 infusions per week. And there's no side effects, I think that's a possibility. There is one published case of a woman who had DCIS who did a natural protocol. She did dietary changes and some Chinese herbs and acupuncture, and her DCIS went away, and they documented it, published it. It was a naturopathic group in Portland, Oregon. And I think that kind of documentation needs to happen more and more so that doctors can be encouraged toward using more natural, less invasive approaches. And I think that's really the invitation with DCIS, is to move in that direction. At the present time, 98% of all DCIS cases are treated surgically.
Right.
And if you're considered a high risk situation, which would be like a younger woman with DCIS, they're considered a high risk.
Mm-hmm.
Or if you're an African American, you're almost always told to get a mastectomy. And that's just, it's such an extreme position when we think about the possibility that you could postpone that treatment. You could postpone that treatment and monitor the situation with something like breast thermography, because the thermography will tell you if there's changes happening that indicate potential progression. And then you can take steps accordingly. At that point, you might do the intensive vitamin C therapy, which again is a much less drastic way to do it than cutting your breasts off. So I think I think it's a fascinating issue, because we're at a crossroads. We're having to decide whether we want to stick to the old brute force tactics, which are very, very old. Surgery for cancer is over 1,000 years old. Ancient Egypt, they were cutting out tumors, and we basically grandfathered it in. And it's an old way of thinking. And we need to have a more evolved way of thinking. I like to think of, I used the analogy of criminals before. If you think back to 9/11, after 9/11, when all people of Middle Eastern descent were suddenly suspect, you go to an airport and anybody of Middle Eastern descent was, very apprehensive about being pulled aside because they were being profiled. And I think this is kind of profiling of cells. Cancer, DCIS is not it's not an evil entity. You know, it's just it's just that we call it carcinoma. And I think what we're going to see eventually is a de-escalation of the terminology, so that we start to call it something like IDLE, which is indolent lesions of epithelial origin.
Right.
And that'll apply to the lower risk DCIS. The high grade DCIS will probably remain DCIS, but it's pretty clear that the lower risk DCIS situations, like you said, are not going to progress in most cases, and we can change. This is the key thing. Cancer is not a linear inevitability. It doesn't continue to go. When people think that they have cancer, or let's say you get DCIS, but there's some concern about maybe some cells that could be cancerous mixed in with it that are invasive. In most cases, the progression is still going to be very favorable, and more to the point, you can control the progression. You can change it. That's the message I want to bring forth, is that it's not an inevitability.
I totally agree with you. Unfortunately, things are kind of ruled by fear, especially when it comes to issues like that, both from the medical community as well as from the patient community as well. Media doesn't help. We have this kind of notion in our society that once you have cancer, it's almost like a life sentence. But again, the whole idea here is to empower people, women specifically, with information so that they know, first of all, it's not as bad as it sounds. And the prognosis actually for survivor in terms of mortality is very, very low. So your surviving rate is very, very high. And also, let's talk a little bit about what can they do. Okay, nutrition, anti-inflammatory diet, what else?
Well, and I just want to say, before I say this, it's important for women to know that right now there are 3 very large randomized trials going on where women are being told that they either can do surgery or no surgery. And these are taking place now. The problem with these huge studies is they're not telling women what to do if they don't get surgery. So that's why I really appreciate your question. And sorry, my phone is ringing here. Okay, I'm not going to answer right now. And I think first of all, the reason I mentioned breast thermography before is I see breast thermography as being a good way for women to couple their dietary and lifestyle changes with a monitoring tool that can tell them whether it's actually helping. Because if you get a baseline thermogram, it's going to show, in the case of DCIS, it's not going to look like very much at all. It's going to look pretty normal. And that's actually a good thing, because that indicates that it is pretty normal. And so if you then look at your diet, and let's say that you've eaten a lot of meat in the past, you want to drop your meat from the diet, because meat could have been feeding a situation that encouraged that group of abnormal cells to crop up, and that probably took 8 or 10 years to happen. And so anything that was a pattern in your recent past needs to be changed. If you've been eating a lot of chicken, chicken is a source of a lot of omega-6s that feed inflammation, and that inflammation is critical to the evolution of cancer. And perhaps at that, you could instead eat more fish instead of the chicken. If you, in general, haven't been eating much in the way of vegetables, you could increase your vegetable intake and your fruit intake. And I often encourage people to use these superfood concentrates. I found a few that I found incredibly helpful to getting the what's called a phytonutrient equivalent of, say, 10 or 15 servings of vegetables in a single superfood shake. And these are very practical ways to get your nutrition back on a very strong cancer-repelling track. Because essentially we're just talking about cancer prevention. The guidelines for cancer prevention are very well established. Lots of fruits and vegetables, cutting back on meat, avoiding processed food and refined sugars. I keep getting a phone call here, but it's a very, very important issue. I think to first change your diet. Then I think also exercise is extremely important. We know that women who exercise more not only can prevent cancer initially, but if they do develop cancer and you start exercising, your ability to prevent a recurrence of cancer is greatly reduced. And so I think the same guidelines that have applied to preventing recurrences could apply to, say, a woman with DCIS who wants to prevent progression. The issue with DCIS, by the way, is a lot of women will have a recurrence if they have, let's say you just get a surgery, a local surgery, but you don't get radiation treatment. Those women will often have a recurrence. That recurrence is not necessarily a terrible thing. It's not like a recurrence, that happens with other kinds of breast cancer. This is, again, really a pre-cancer. It's not a cancer. And so it is, if you have a recurrence, it's again more of a reminder, okay, I got to really focus more intensively on these changes. I also do recommend things like certain anti-inflammatory herbs like curcumin and combinations, like there's one called scutellaria, which is scutellaria is a Chinese herb that's added to a lot of herbal formulas, and that's very anti-inflammatory. And it has an added benefit of bringing your stress chemicals down, which brings us to the other issue, which is stress. And women who manage their stress well also change the chemistry of the body in such a way that you will discourage breast cancer. So that's an extremely important area. And I think the emotional healing and stress reduction area is one that I've taken a deep interest in because I've seen so many women who have had in very recent life immensely stressful experience, and then they develop breast cancer. So I think it has a profound role to play in helping women develop resistance to further cancer.
For sure. The psycho-emotional component,
yeah,
which is very difficult to deal with. It's much easier to say, reduce your stress than actually do it for these individuals. They kind of got themselves into a bind for whatever reason, and it's very difficult for them to step out of this.
Right.
Whether they can talk to someone or they can do something to reduce their stress in a healthful way, exercise, meditation, yoga, any kind of practice like that on daily basis definitely helps to keep them healthy or to recover.
Yeah, so, and I think healthy stress management practices are really important. I think some people will slip into unhealthy patterns like alcohol or smoking or even smoking pot, which I don't consider to be a healthy way to deal with it at all. And I think, in fact, smoking pot is going to encourage breast cancer. So, on the other hand, maybe using, the CBD oil is a different matter. But the issue of the way people respond to the stress in their life is really, really key. I'm a big believer in meditation and deep relaxation practices.
Yeah, you're absolutely right. It's not what happens, it's how we react to it. Yeah. So just to summarize and to go through, let's say, 3 main points of what would you recommend people in terms of prevention?
Okay. I would say number one, anti-inflammatory plant-based diet. I think that's very, very important with supplements to support that. I think that's very helpful. Number two, I would say movement, different kinds of movement, dancing, running, swimming, exercising, just moving the body. And then number three, stress.
Stress management.
Stress management, positive attitude along with, things that are really supporting your resilience and your ability to relax, and intentional practices around relaxation can be profoundly helpful. So these are very practical things that will translate into better breast cancer prevention and control over the long term.
That's great. Thank you very much for taking the time. I just wanted to let people know that anyone who wants to get in touch with you, they can do that through selfhealingoptions.com. I really appreciate your knowledge, your understanding, and your passion.
Thank you. Thank you. I should add that the reason I use my middle name, Nathaniel, Mark Nathaniel Mead, is that I also have written a fair number of things, and so I use Nathaniel as my author's name. So if you're trying to find me in terms of what I've written, that's why I introduced myself as Mark Nathaniel Mead. So
that's great. Thank you for mentioning that too. Okay.
Okay. Thank you.
Take care.
Okay. Bye-bye.